So I think one shift we are seeing is patient is asking more questions
Yeah.
about ingredients, about the dosage, about the mechanism, about the research as well, because there are so many informations that is available online and even through the AI. So how is that influencing the way that pharmacists engage with, such as supplements like ubiquinol? How do you explain to the patients as a community pharmacist and also for yourself, Bobby, as well, as a pharmacist educator, what are the unique things that we can share with patients or maybe the group of pharmacists?
Look, I think for me, evidence. As a pharmacist, over nearly 30 years now as a pharmacist, we are asked all the time about products. We're asked all the time about ingredients, and it always comes to the evidence. So for me, as a pharmacist, what gives me confidence and enables me to share that confidence with my patients is that strong background in science, that strong background in the evidence. And for me, when we're thinking about nutrients, when we're thinking about ingredients like ubiquinol, over 100 studies, there's a lot of evidence there. There's a lot of research there. And for me, it's not even just accepting that evidence and that research at face value, but as a health professional, I really need to be immersing myself in that evidence. I need to be hearing about that evidence. I need to be attending conferences, sessions, education, and understanding that evidence. Only then can we share that recommendation confidently with our patients. And that's really, really important.
Yes. How about you, Gina?
Yes, I agree on that. For me, in Malaysia setting, there are so many channels, in getting, talking about healthcare supplements, nutritional food, and so on. So for me, I always go back to the mainstream because we study science. Okay, so the science, I would say there's always go back to evidence. So as long as you have the evidence backup, and even when people trying to challenge you, they say that, what are you talking about? So that's why I always educate my patients to say that, I am in this line. I'm a pharmacist, so in order to tell you more about this, I still believe to go back to evidence-based medicine. So otherwise, how can we compete with improving of AI and all that? Or how about social media channel? There's so many of them. So that's why it's important to look at active ingredients that's backed by science.